A very good morning to all the noble souls present here today, and also a warm welcome to all watching us on Facebook and YouTube. Today, we are going to take up a very important and relevant topic. But before I go any further, I request you all to please share the link as much as you can in your family and friend groups. Warm up your tea and coffee and stay tuned. मैं टॉपिक एंड आज के एक्सपर्ट्स का नाम अनाउंस करूं उससे पहले हम अपने को और सराउंडिंग को पॉजिटिव एनर्जी से चार्ज करते हैं एंड फॉर दैट आई वुड लाइक टू इनवाइट मिस इंदु जैन टू डू द मॉर्निंग प्रेयर. इंदु जी.
हेलो, गुड मॉर्निंग एवरीवन. सबसे पहले डॉक्टर के अग्रवाल की श्रद्धेय नमन, उनकी दिवंगत आत्मा को नमन. इट्स 19 फरवरी 2022 सॉरी एंड इट्स सैटरडे. और आज की प्रेयर हेल्थ दरबार से पहले मैं शुरू कर रही हूँ. तुभ्यं नमः त्रिभुवनार्ति हराय नाथ, तुभ्यं नमः क्षितितलामल भूषणाय, तुभ्यं नमः श्री जगत परमेश्वराय, तुभ्यं नमो जिन भवोदधिशोषणाय. हे भगवान, हे परम नमस्करणीय देवादिदेव, आप तीन लोगों की पीड़ाओं, व्यथाओं, वेदनाओं, यातनाओं को हरण करने में समर्थ है. अतएव आपके लिए बारंबार नमस्कार है. आप ऊर्ध्वलोक, मध्यलोक तथा अध्योलोक के पवित्र पावन मंडन मनोज्ञ अलंकार रूप हो. अतएव आपके लिए बारंबार नमस्कार है. आप त्रिभुवन के जगदीश्वर है, परमेश्वर है, प्रभु है. अतः आपके लिए बारंबार नमस्कार है. आप संसार रूपी अथाह समुद्र को अपने प्रचंड तेज से सोख लेने में सक्षम हो, इसलिए आपको बारंबार नमस्कार है, बारंबार नमस्कार है. थैंक यू एवरीवन. ओवर टू यू डॉक्टर मीनल.
Thank you so much, Indu ji, for the soothing and calming prayer this morning. It is always a big dose of positivity to start our day with remembering the Almighty and seeking divine blessings. Without much delay, I would like to announce today's topic, and the topic is diabetic foot and its management. To spread the awareness about this, Dr. Meenal Shahji with us. Dr. Meenal ji is a physiotherapist from Mumbai who is an HCFI member and who believes that movement is medicine and strives towards providing the latest and improved pain management for diabetic patients. I extend a very warm welcome to Dr. Meenal on Health Darbar started by Shraddheya Dr. KK sir. Over to you, Dr. Meenal.
Thank you so much, Vibhaji, for having me. And it has always been a pleasure to be a part of the HCFI family. It always feels like I'm coming back home to talk to my own family. So thank you for always having me and giving me the opportunity to be able to continue Dr. KK's dream. Without further ado, we will get started with today's topic. There will be certain areas where there are slides which are very informative. So I will be asking you to take a screenshot of it for your future reference, or maybe those slides you can send it across to your friends, family. That will be really helpful to give you small packets of information. Other than that, throughout the session, if anybody has any questions, I would be more than happy to answer them right when the session ends. We have kept a slot for about 10 minutes where everybody can come, talk to us, discuss their issues, and maybe, get more information for them and for others who choose to see it later on. I'm going to start sharing my screen. And just let me know as soon as you can see it. Just give me a moment. Is everybody able to see my screen?
Starting only.
Okay, just give me a moment.
Screen is black, Meenal.
Yeah, just give me a second. It's loading.
Yeah, now it's visible.
Yeah, just a second. Make this in a way so that people can see it better. Just a second. Just let me know if you can see the screen move or the slide move. Once that is done, we should be good to go. Is this visible now?
Yeah, the first slide, diabetic foot physiotherapy management, is showing.
Yes. I'm just trying to start the slideshow. I don't know why it's taking a minute. Just give me a minute.
Yeah. No problem.
Onward soon. Is this visible now?
Only for that first slide we can see, not second one. The topic we can see.
I don't know why it's not going
Not
forward.
going on second slide actually.
Yeah, that's what I'm able to see it, but it's not getting shared. Just a second. Let me stop and maybe start again. Okay, this should work.
Move to second slide, then the first one is only showing.
Are they on the second one?
Yeah, disclaimer, yeah.
Lovely. Is my video visible to everybody?
No.
Now?
Now we can see.
Perfect. Sorry for the glitch. This is a basic disclaimer. The following presentation is for education reference only and for your knowledge and for you to increase your knowledge about the topic. However, please do not take this piece of information and use it as self-diagnosis. If you suspect that you're going through it, there are so many doctors available at your disposal who will be more than willing and happy to help you figure out what is going on with you. But don't take one word or one slide and say, I have it, I'm going to treat it myself. We don't want to do that. We are using this so that you are aware and you catch the disease before it happens. So in the future, you avoid complications, okay? The agenda of this today's session is to make sure that something as common as diabetes, India is the leading country in the world right now. Not something we want to be masters in, but it is so rampant right now. You can see it everywhere. And all the complications that follow with diabetes, people are going through it, but like we know, it is the silent killer. They're not always visible. So my agenda for this presentation is to educate you enough to pick up the signs of the complications as soon as you see them, even before they become complicated diseases which need major interventions like amputations or limbs are being cut off and all of that. So moving on. So again, foot problems are very common with diabetes, and when not treated appropriately or timely, they can lead to amputations. Once that happens, usually within a year, the other foot also undergoes complications and an amputation, which means the person who has diabetes already lost one limb. But even after losing a limb, that does not guarantee that the complications will not occur with the other limb. So we want to make sure we save both of them, all while maintaining the metabolic condition, which is your diabetes mellitus. They are usually categorized with 2 or 3 things which happen simultaneously. One is vascular, which is your blood supply to the limb. Second is your neural, which is your nerve supply to the limb. And all of these are very greatly affected with high sugar levels in the body. I will explain much deeper in the further slides. This is a basic explanation of what is really happening with your body. So why do we need the awareness? Dunya mein to lots of things are happening. People are getting cancer, people are getting way worse diseases. But why the need for this particular diseases, this particular complications awareness? We understand that India is the largest diabetic population, and about 70% of all the amputations that undergo inside an operation theater are all diabetes related. only a very small fraction of amputations comes from other infections and accidents. So diabetes forms a major chunk of the reason that a surgeon has to schedule an amputation for somebody. Also, every 30 seconds, a limb is lost to diabetes. So imagine if we could prevent that, the quality of the life of a lot of people would be in a much better place today. And 1 in 6 people with diabetes will have a foot ulcer at any given point in their life. And after the first amputation, like I said, the contralateral limb, which is the other limb, is lost within a year, either to infection or an ulcer or a repeat amputation of the same or the other limb. And another very shocking and a scary little fact is 40% of the patients will die within the first year of amputation due to various complications. It could be diabetes, it could be infection, it could be improper rehab, it could be lack of awareness of how to take care of the amputated limb. Now, we all know all of this happens, but we are not fed the right information at the right time on how to avoid this, which is what we are going to go through today. So why the foot? Why does it not happen in the hands, nose, ears, eyes? Of course, all those parts are affected, but the reason foot is more affected because it is a way longer extremity. The nerves, the arteries, the veins that go into the foot are longer than anywhere else in the body, which means in order to maintain their integrity, the body has to work more to make sure the blood reaches all your extremities. And when you have had diabetes for a very long time, the higher sugar levels in your body sort of make the lumen very loose. Lumen is the inner portion of an artery. So your blood circulation is affected, your transport of oxygen to your limbs is affected. When your blood circulation and transport of oxygen is affected to the limbs, they do not get the oxygen required to maintain the tissue health. The moment you start losing your tissue health, it will go necrosed because there is no oxygen. The living tissue requires oxygen to function, which it gets from the blood. So because it is a really long extremity where blood circulation is already sort of an issue for the body, in diabetics, this is way more affected. And we are also constantly loading our body. We are constantly putting all our body weight on the foot, on the bones of the foot, which is why we usually see ulcers on the sole of your foot. So what is really happening? So there are ideally 4 reasons why diabetic foot ulcers happen. This is a basic explanation. We are not going into details. I just want you to understand what is going on with your body. Okay, the first one you can see is sensory loss. When you have diabetes, the sensation on the bottom of your foot usually goes for a toss. You will not be able to tell whether you're taking a bath with hot water or dipping your foot in hot water or cold water, which is a major cause of injuries. Imagine if you were walking somewhere and you did not feel the nail hitting your foot. Can you imagine the amount of trauma it will cause? The nail will go in, it will cause an infection. The rusted iron can cause an infection. And this is all happening while the person is completely unaware कि उसके साथ क्या हो रहा है. He thinks कि I'm going about my day. But because of his high blood sugar, the sensation of the bottom of the foot is lost. We have seen in our medical practice that sometimes patients come to us with the footwear, and when we inspect their footwear, you will find the randomest items inside the footwear and the patient isn't aware. We have found keys, we have found small nails, we have found tiles, broken tiles, and the person was walking with it for we don't know how long, but they never felt it. So you can imagine the amount of injuries you can actually go through without ever feeling them, but it is still causing a damage and infection to where the trauma was caused. So one, we did sensory loss. Now second is autonomic dysfunction. Now what is autonomic dysfunction? Your body has an ability to produce sebum. It has an ability to increase and lower your blood pressure whenever it wants. It has an ability to make you perspire whenever it is required for you to lose body heat. When you have diabetes, all these processes are altered because of high blood sugar levels, and the body is constantly trying to meet homeostasis, its natural state. So what happens is when your body does not recognize when to release moisture, when to lock it in, you have dry feet. When you have dry feet, it is an invitation for tiny cracks to form. Now, when you have tiny cracks, very small particles can lodge in them. You will not feel them. Even a normal person will not be able to feel them. But when you have diabetes, bigger things can lodge into those cracks and you will not feel them for days on end. And that leads to an ulcer, which again leads to a tissue loss. Third is motor paralysis. When you have sugar, when you put your foot down, usually you feel the pressure of the ground, you feel how much force you're putting. आपने देखा होगा कभी कभी सीढ़ी से नीचे उतरते हुए एक सीढ़ी मिस हो गई तो how dizzy do we feel? When you miss a step, you feel like, oh, did I just fall down? No. Your body knows how much pressure to put in the next step, but if the step is missing, your body doesn't know what to do with the pressure, which is why you feel like, oh, you've just fallen down. So similarly, when you have diabetes, there is an altered sense of pressure. So you don't really know how you're putting your foot. So usually if you put your foot like this, and if you have diabetes, even if you're putting it like this, you won't realize it because your body is losing the sense of pressure. Your body is forgetting where it is supposed to put pressure and where it is not. So you are constantly walking for days on end with bad footwear without realizing if you have any cuts or calluses, and you're walking abnormally. So in the end, the bones at the bottom of your foot are getting affected and they are just rubbing on the floor and causing an ulcer, which causes tissue loss. And PAD is peripheral arterial disease, which is all the arteries in your periphery do not send adequate amount of blood and oxygen, which leads to ischemia. Ischemia is lack of oxygen in the area, which in turn leads to an ulcer, infection, and tissue loss. I know this was a little lengthy, but these are the only 4 reasons you can ever have an ulcer. And all these 4 reasons can be narrowed down once we look at the ulcer and determine the cause. And once we have determined the cause, it is very easy to treat it and get out of it by avoiding an amputation in the longer run. Is everybody with me? I know this is a little complicated, but we'll get to easier parts very soon. So what is a high risk foot? We know we can have an injury. We know we can have diabetic foot disease. What classifies as a high risk foot? Ki haan, ye person ko to hone wala hai ye issue. So the first is peripheral neuropathy. Like we said, nerves is feeling the pressure. So neuropathy, pathy means there is an issue, there's a disease, it is affected, it is altered. So nerves are affected. So peripheral nerves, nerves in your hands and your feet, they are affected. Then you have peripheral vascular disease. Like I said, the oxygen doesn't reach the area because of lack of blood flow. Then you have poor biomechanics. When you don't know how you're landing your foot on the floor, you're constantly causing trauma. Then you have poor cognitive state. Now, if you have someone around you who has diabetes, you will notice a lot of mood changes in them, which also changes the way they carry their body in space, which can in turn lead to foot injuries, trauma, cracks which are ignored, injuries which are ignored, not inspected. Then obviously we have trauma, road traffic accidents, falling off, not being able to feel the step and falling off, causing a trauma, twisted ankle, all of those. Previous ulcers, if you've had diabetic ulcers before, there is a very high chance if you don't take care of it, they will keep happening again and again because it is a breeding ground for those. Obesity, if you are morbidly obese, you are again putting pressure on your foot, which is rubbing the bones on the bottom of your foot to the floor, which can cause ulcers. Now, it has been noticed that males have a higher predisposition of these ulcers than females for a multitude of reasons, which we don't need to discuss now. And the last one is lack of education. This should have actually been first, my bad. But if people were educated the day they are diagnosed with diabetes, about 80% of the amputations could have been ignored. A lot of times, because of lack of education, people think कि अरे हमें कौन हो गया है, वो एक छोटा पत्थर गया था, कौन हो गया है. People don't realize it takes only 7 to 10 days for that to turn into a full-blown infection before you even notice it. So lack of education is really the crux of this issue. We will see in the further slides why it is happening. So these, if you want to take a screenshot, you can take this and remember these. These are the areas where you will find most of these diabetic related foot issues. You will see a very peculiar pattern when you see these patients or when you see your relatives and you're trying to figure out what's going on in their foot. You can just ask them to sit down with their foot facing you, and you can see all these areas which are marked in red. They will either have thin skin over there, they will either have calluses, they might either have very small tiny cuts and bumps. But these are the telltale areas ki idhar hai to you have to go for inspection. Now, what are the signs and symptoms? How can you recognize ki something diabetes related is happening to the foot? You will have a burning sensation in your foot for no reason, because the nerves over there are undergoing neuropathy, like I said earlier. Swelling of the feet and legs. Every time you get a cut, every time you get an injury, you will obviously have inflammation over there, which will cause swelling of the feet and legs. And also, when you have diabetes, you have arthropathies. Even your bone formation is affected, which can cause various musculoskeletal issues. Then you have loss of sensation to cold or touch. Like I said earlier, people cannot recognize whether their foot is being dipped in cold water or hot water, which is a big safety hazard. Then you will see the nails getting very thick and yellow. You will also see blisters, red spots, everything on the bottom of your foot. And foot arthropathy, like I said, because of uneven pressure distribution on your foot, there are areas of your foot which will start taking more pressure and they will have deformities. I have further slides on how they look like. And what is the purpose of foot care that we will impart to these people? We want to make sure these patients have proper mobility and function. They're able to do their day-to-day activities without any hindrance. We want to prevent an ulcer. We want to prevent the injury of the foot. We want to promote healing. If we have had ulcer, that's okay. It is manageable. But we have to make sure we are prompt in our action. We have to make sure we are very focused in dealing with the disease and not just take it as, oh, okay, it's going on. It'll go someday. We'll take care of it. We don't need that attitude here. This is a very serious thing. We also want to prevent an infection, which is the case in any scenario, diabetic or not. We do not want an infection. And last and most importantly, we want to save the limb from amputation and preserve it for the patient to use it for their benefit. You can take a screenshot of this. This is like your basic checklist of how to check a diabetic foot. And you don't need to be a doctor to do that. Anybody can just go through it and understand. The first one is deformity. Deformity is you can have a flat foot, you can have a foot which is curved like this, you can have a foot where the fingers are not touching the floor, you can have a foot where the sole is not touching the floor and only fingers are touching the floor. There are various deformities. Anything that deviates from normal would be a deformity. Okay. Second is infection. Person will have fever, person will feel lethargic, you will see redness around the area of the injury. Your normal signs of infection that I think everybody knows now. Atrophic nails. You will also see, like I said, you will see thickening of the nails. You will see brittleness in the nails. They will form layers which keep peeling. You will notice all of that. You will also notice breakdown. Breakdown means the breakdown of the skin, which is the basic barrier that protects you from the outer world to your body. You will see breakdown in that barrier. Edema, which is the swelling of the foot. Temperature will increase because obviously we have inflammation, so you will see higher temperatures. Now, one way to detect this is place both of your feet together. Use the back of your hand to compare temperatures of both the feet to say that which one is warm and which one is normal. It will not be exponentially warm, but it will be warmer than the other extremity. Okay. Then you will look for ischemia. Ischemia is lack of oxygen reaching the area. The color of that area will turn completely black. You will see it in the pictures going forward. Callusitis, you will see calluses being formed. It will look like corns, but it is always your best bet to get it examined by a healthcare professional. And skin color will change because you have an infection, you have a breakdown. It will be whitish in color. It could even be red. It could be brown, black, anything that deviates from the normal skin color. That is what it will be. How does an ulcer develop? You can see stage 1, there is nothing. Stage 2, superficial ulcer, where you just rub it and you will realize that, there is redness. You can see that there is pressure being subjected to that area. So these are various stages, and the last stage where the foot has, you can see gangrene formation over there. So that area has been completely necrosed. That area has not received any oxygen to keep itself alive for a really long time. So this calls for an amputation. And in stage 4, you can see there is partial gangrene of the foot. In cases with partial gangrene of the foot, nowadays surgeons also go for partial amputation of the foot. The entire foot does not need to go away. You could only choose the area which is very deeply affected and choose to get rid of only that part of the area and preserve the rest of the foot. Now the next picture, if you don't like it, you can skip it, but this is what it will look like. It will be very obvious, but on the right side, you can see these are small blisters that you will see. Usually we call them corn and we ignore it and we forget about it until they turn into something that you see on the left side, and then it's too late. So now we know what happens, but who can we really go to? Do we go to a doctor? Do we go to a physician? That is a big question. And हाँ मुझे इसने बोला था इसके पास जाना है, इसने बोला था इसके पास. So we go to everybody and we go shopping, and we end up window shopping, and then nothing happens, and वो कौन ही रह जाता है. So this is your basic guide on who to go to. Your family doctor would be the best person to guide you. If he is not available, you can go to any surgeon. Just send them a picture of your foot. Tell them you need to get it assessed. They will be more than happy to help you. Physiotherapists work very closely with diabetics, and they will be able to help you manage the disease. They will not, bandage the ulcer. They can debride it. They can remove all the infective tissue from it, but you will need medical management, which you will have to get from your diabetologist. Now, what are podiatrists? Podiatrists are doctors which specialize in foot and foot care and foot surgeries. They are very well versed with foot issues. So you could go to those. You could just Google podiatrists in your area and look for them. Vascular surgeons, people who look after the blood flow and the arteries, because we know the blood flow was affected because of diabetes. So you can decide and choose your specialty and go to whoever you feel comfortable. However, if you go to the wrong doctor, usually they will guide you to somebody who can help you. But make sure, see, I have given you so many options. You have a multitude of options you can go to for help. But please don't sit at home and try to fix it with a needle and removing. We have had patients like that, who sit they heat up a needle and they try to remove small tissue, which in turn causes infections. Do not try to DIY the treatment. There is a reason we are put through rigorous training on how to deal with these things. And it requires an utmost amount of attention and care. And if given it at the right time, you could actually save your limb. So please keep that in mind and visit whoever you want from this long list of people waiting to help you. Now, these are the 4 pillars of diabetic foot management. Again, you do not have to be a doctor to do this. You can do this at home on your own. What is very cool to notice is you can cut down the amputation rate by 88%, which is a huge number when it comes to saving a limb. And these are the 4 basic rules: regular inspection of the foot and patient education. Like I said earlier, it is the cornerstone of making sure your foot is intact and a part of your body if you are educated at the right time. Identification of the foot at risk, which we read earlier, the checklist of if you have any of these things, you should visit a healthcare practitioner. Now, third, very important, appropriate footwear. Why appropriate footwear is because you're going to use it all day and you're going to put pressure on your foot all day. When the pressure is not put evenly, you will end up with an ulcer, and we don't want that. We want good protective footwear. We want closed footwear, which give room to your toes to wiggle. So your toes are not held tightly together. We want footwear that you are comfortable in. We want footwear that support the areas of your foot which take the most pressure. So there is lowest amount of wear and tear possible. And the last one is multidisciplinary approach with regular and consistent follow-ups. Now, what is a multidisciplinary approach, you ask? It is basically a bunch of specialities of doctors working together towards a common goal of making you better. So when I give you a list of all the people you can visit, ideally they would work together towards one foot. So you can imagine how complicated this condition really is. There are about 6 or 7 specialities which are required to fully, completely treat this disease. Which is why when I say don't DIY it at home, leave it to the professionals, they know best. Now, patient education, which I wish everybody should get this as a WhatsApp message every morning when they wake up instead of a good morning. Foot hygiene, daily inspection, proper footwear like we saw. Prompt treatment of new lesions. If you even see a minor crack, treat it, sterilize it, get it checked. Right now, it's very easy. Click a picture, get it checked. If you feel like you have a fever, do a regular blood test. Talk to your GP, talk to your orthopedic, talk to your podiatrist, talk to your physiotherapist. You have a multitude of options. The choice is up to you. Then disease management, very important. When we focus on the foot, we forget why it is the foot in the first place. It's your diabetes. Are you taking care of your sugar intake? Are you making sure your insulin is being taken on time? Are you checking your HbA1c levels regularly? Are you taking care of your nutrition? Are you drinking enough water? Are you doing your regular exercises to maintain your insulin levels? All these things are extremely, extremely important to save your limb. Routine nail care. Sometimes your own nail can cause cracks in your foot when you have an ingrown nail. So with diabetics, we want to make sure we do not cut their nails, we file their nails in a straight line. Because if we cut, we will risk cutting the area which touches the nail and the foot, which can in turn lead to other infections. And we don't want that. One second. Can you see my?
Yeah.
Okay, good. You guys can take a screenshot of this. This is a basic guideline on how to take care of your foot. What you can do is, one second. Yeah. What you can do is every day we need you to wash your feet. I know at least 10 people at the top of my head who would go out, come back home, directly jump on their bed and go to sleep. Your feet were inside a pair of shoes which were running around the whole wide world, or they were in a pair of chappals where you have dust, dirt, pollen, allergies, everything you could imagine, and you take that to your bed. And how do you expect it to not give you infections and diseases? It doesn't work that well. You have to wash your feet and you have to keep them dry. Wet feet is another breeding ground for infections. The area between your toes need to be cleaned properly and dried. You have to keep the skin soft. Earlier, when I said it causes cracked skin because your body doesn't know where to give moisture and where not to give moisture. So we support it externally by making sure the foot is moisturized at all times. Then you have to inspect your feet. Now, we can't always, pick up our feet. We are not always that flexible. So I advise you to take a mirror and look at the bottom of your feet. Inspect it every day. It hardly takes 30 seconds, but it can save your limb. Then the next most important is ask your diabetes team on how to take care of your toenails. Ideally, they will show it to you. They will show you how to file it. Or there is something called a medical pedicure, where a podiatrist will give you a pedicure which will take care of, it is not like your regular parlor pedicure. They sort of get rid of all the dead skin one by one in a very sterile environment. They make sure your foot is well rested. They make sure the skin is soft when you leave. So all of that, but in a very medical context and a very disease prevention context goes on over there. Also, wear clean, soft socks that fit you. We want to keep the foot covered as much as possible and away from all the external environments. One more thing which is not mentioned here is when you wear socks, always wear white socks if you have diabetes. Because if you get a cut, ulcer, if you get anything and it bleeds, it's easier to spot on a white sock. It is faster to spot on a white sock compared to a black, brown, blue color. And the faster you spot it, the faster you can treat it. Okay. Next, always walk with your footwear indoors or outdoors. Now everybody wears shoes in the house. It's not that big of a deal. Keep different pairs which are comfortable for you. Do not walk barefoot because you will not realize when you got hurt. And that can turn into a bigger injury. And the last one, very important, examine every day. It takes 30 seconds, but it can save your limb. Now, multidisciplinary approach, what happens in there? Debridement. Debridement is we sort of open up your wound and we take out all the infected areas and we sort of put it in a sterile gauze and wrap it up. Then meticulous wound care, we make sure that the wound isn't growing. We make sure it is properly disinfected. Adequate vascular supply. We make sure that there is proper blood flow coming to the area so healing is faster. So you can come out of it faster. Metabolic syndrome management is your diabetes management with your food, nutrition, water, sleep, mental health, physical health, exercise, everything that comes under diabetic management. Again, antimicrobial, we want to be as aseptic as possible. Then offloading unnecessary pressure on the ulcer. So when you're walking, you will get an ulcer where there is a bony prominence. Now we want to make sure ulcer to ho gaya hai. Now how do we prevent it from going to the bone? We offload the pressure on it by giving it cushion or support. There are special shoes for that. They take the measurement of your foot. They take a print of your foot and see. There are devices for that. They see where you are giving more pressure, where you're giving less pressure, and they will make customized footwear or insoles for you. And the last one is limited amputation. Earlier, we used to do either a Symes amputation or a below knee amputation if we saw some ulcer or gangrene. Now we have started with only amputating the toes, only amputating a certain part of the foot. Slowly, things are being developed to preserve as much limb as possible. Now, what are the outcomes? We know what happens, we know who to go to, but theek hoke bhi kitna theek hota hai? So a good outcome, usually we see in 50 to 70% of moderate to severe cases and 80 to 90% of mild cases. Ideally see good outcomes if help is received in time with appropriate aseptic measures. Can you imagine this 70 to 80% of the people were about to lose a limb, but we made sure that they got appropriate care, they had appropriate follow-up, and they are now using their limb to walk around the place and live their life. And poor outcomes, they are usually associated when the person has a systemic infection, when the infection is so big that it is affecting their body. When they have limb ischemia, the whole limb is not receiving oxygen. Here in these outcomes, usually you have to go for an amputation to save the other parts of your body. Now, what is offloading? Again, good footwear, good orthotic support.
Excuse me, Dr. Meenal. Can we do a little faster because
we're almost done. We're almost done.
Because we have to.
I'm not going through it. We're almost done. Yeah. So this is what they look like. You will have various ones. I cannot tell you just one because it will be different for everybody. This is a basic idea of what they work with. Now, what does physiotherapy do? Luckily, we work with the best area of this thing, which is prevention. And why prevention? Because what we have noticed is as physiotherapists, we get the maximum face time with the patient. We see them at least 2 to 3 times a week for about an hour. So it is ideally upon us to talk to you, educate you, put you in a place where you are intuitive of your own body rather than waiting for someone to come and tell you. Early detection of neuropathy is important. Early referral of patient. If you notice, the first 3 points say early. So we want you to act as quickly as possible. We want you to self-examine daily. Again, the same thing. You have to have glycemic control, good footwear, appropriate, avoid foot trauma, and completely stop smoking if you're on it. This is basically what physiotherapy does. If you want, you can take a screenshot, but what it says is regular physical exercise will act as insulin to maintain your blood glucose levels. And when your blood glucose levels are maintained, you can have faster healing, faster recovery, and lower recurrence of upcoming ulcers. And when you have ulcers, you will see people will limp. When they limp, you will realize that their knee goes for a toss, their hip goes for a toss. So as physios, we make sure that all the other parts of your body are fully mobile. They have complete range of motion, strength and endurance is maintained, and everything else other than the affected part. Now, this is one particular exercise called Allen Burgers exercises. So this has been devised just for ulcers and people who are going through diabetic foot issues, where they raise your foot all the way up so that there is backflow of all the material over there, and you again put it down. So it is sort of a gravity based exercise where they play around with gravity, with the angle of elevation and your blood flow. This has shown the most promising results non-invasively with diabetic foot issues, because you also know that when you have high blood sugar levels, a surgery is a very risky task for you to undertake. So this is one of your golden exercises which you can use. Obviously under the guidance of a therapist, don't do it yourself, leave it to the professionals. Diabetic footwear, as we saw earlier, basic offloading, it is the cornerstone of maintaining your foot. Now we're almost done. This is the take home message. Diabetics should treat their feet like their face. Look at it every day, take care of it, moisturize it, clean it, cut your nails properly, file it, make it look pretty, wear white socks. If you get a cut, act immediately. You know, when we get a pimple, we run to 40 remedies. Why not with the foot? Okay. And I want you to understand that this is completely avoidable. This is absolutely and completely avoidable if detected early. Anyone has any questions? We are open. Please go ahead.
Yeah, actually, Dr. Meenal, we are running short of time. So maybe you can answer those.
Sure, no problem. They could just drop me a message.
Or we will have on some other day. And definitely it was indeed a very informative and eye-opener session.
Thank you so much.
Usually diabetic foot को हम ignore कर देते हैं. तो whenever you are having some wound, please check that why it is not healing, और अपने डॉक्टर के पास जाएं एंड हेल्थ दरबार की वीडियोस को देखें. डॉक्टर मीनल ने बहुत ही अच्छी जानकारी दी है, और इसको आप फिर से वीडियो को जाकर के हमारे वेबसाइट पे देख सकते हैं. And with this, I would like to convey my heartfelt gratitude to Dr. Meenal for sharing her valuable insight on this extremely important topic, which has helped us learn about diabetic foot. I also convey my gratitude to all the people present here and also to those who are joining us on Facebook and YouTube. आपको ये सेशन कैसा लगा कमेंट बॉक्स में जरूर लिखें. इससे हमें और हमारी पूरी टीम एंड एक्सपर्ट को मोटिवेशन मिलती है. लास्ट बट नॉट द लीस्ट, आई रिक्वेस्ट यू ऑल टू लाइक, शेयर एंड सब्सक्राइब. एंड हाँ, बेल को दबाना ना भूलें. इससे टाइम पे आपको हमारे प्रोग्राम की नोटिफिकेशन मिलती है. With this, I am going to end this session. Thank you so much, Dr. Meenal, for being here.